So let's talk more specifically about laser acupuncture and the term photobiomodulation. Basically, the development of laser acupuncture starts almost 5 decades ago. In 1975, a German physician named Friedrich Plog conducted several experiments. And basically, he was responsible for designing the necessary procedures and instruments for laser acupuncture therapy. So already in 1975, there was the first instrument. The first laser pen was built by a German company. In 1979, a Chinese surgeon named Zhou used laser acupuncture for anesthesia in dentistry. He used the large intestine 4 acupuncture point, Hegu, for pain relief of teeth extraction in the lower jaw. So he stimulates the Hegu, large intestine 4, for 5 minutes with red light laser to induce anesthesia. Okay, but ever since then, laser acupuncture became very developed and commonly used all over the world. So due to that, the number of studies of laser acupuncture in scientific databases is growing rapidly. So as you can see, the majority of the publications are coming from China, but also Europe, Austria and Germany, the US, Australia, Japan, Canada, and so on, Korea, many countries from all over the world, and all together in PubMed, there are over than 900 publications as for August 2018. So it's quite a lot. Laser acupuncture is becoming more and more popular to use. And due to that, the World Association for Photobiomodulation Therapy, known as WALT, in their 12th International Congress, they finally decided to give a definition for laser acupuncture. And it goes like this: photonic stimulation of acupuncture points and areas to initiate therapeutic effect similar to needle therapies. So this is quite interesting, and we will discuss about it in a minute. Similar to needle therapies, together with the benefits of LLLT, low-level laser therapy, or what's known to be called photobiomodulation. Okay? So in terms of preclinical studies, animal lab studies, there is a lot of evidence to support the use of LLLT. Okay, in 1988 already, a researcher from Israel, he conducted in vivo study. He used rats and he exposed their sciatic nerve. Usually in animal lab research, it's easier to expose the sciatic nerve because it's the longest one. Okay, so this nerve was surgically exposed and it was crushed. Okay, as you can see in this figure, it was crushed. And the functional activity of the nerve was 0. Okay, and after it reached to 0, no activity at all, the researchers applied red light laser directly on the nerve, directly on the injury site. And the results were quite amazing, actually. So not only that LLLT showed immediate protective effect, increased the functional activity of the injured sciatic nerve. So there were two groups, okay, the same conditions, the same experimental procedure. One group received laser radiation, and after several minutes, the functional activity of the injured nerve came back to 100. Okay, it's quite amazing. And the other group who did not receive laser, obviously their functional activity was 0, no activity at all. But what is more interesting is that LLLT preserved functional activity in a follow-up of 1 year. Okay, when they compared the results after 1 year of the two groups, they saw that rats that received the LLLT preserve a higher functional activity. So we already know, not only using laser acupuncture therapy, but also using the LLLT in physical therapy or rehabilitation. We know that laser has physiological effects such as it can relieve pain, it can reduce inflammation, promote circulation. Okay, basically laser was first applied to treat wound healing. Okay, locally wound healing with laser light can promote the circulation and reduce the inflammation. So all of this is already known, and there is strong evidence to support the use of laser for all of these physiological effects. But what is more interesting is that laser has the ability to regenerate tissue, okay? And more specifically in our case, to regenerate nerve tissue. But how laser light is doing that? So this is the question we want to do. How laser stimulation stimulates acupuncture points. So in order to answer that, I added this research. It's in vitro cell research of a single mast cell. Okay, so they took a single mast cell from a human connective tissue. Okay, so this is the mast cell before they irradiate red light laser. Okay, so after a few minutes of laser irradiation, the mast cell started to degranulate. Okay, and due to that, he released histamine. Okay, so as you can see, this is after 10 minutes, and after 25 minutes, the mast cell changes form and degranulates. Okay, as compared to mast cell that was not illuminated by any red laser light, it didn't have any effect under the same experimental condition. So when the histamine concentration increases, the peripheral nociceptor became depolarized. Okay, so what does it mean? The peripheral nociceptors became depolarized. Basically, laser light provided a rhythmic discharge of nociceptors. And in order to explain you what does it mean, we need to briefly discuss about the role of acupuncture anesthesia, okay, in order to understand it. So the figure starts from here. When we use a metal needle, we prick the skin with a metal needle, okay, and then in the tissue, there is a release of different chemical substances like histamine or bradykinin or ATP. Okay, and the moment their concentration is increased, the peripheral nociceptors, those nerve fibers, the peripheral nerve fibers, becoming depolarized, and this rhythmic discharge, this cascade of electrical signals, okay, known to be called action potential, is generated and transmitted to the central nervous system. It's transmitted to the brain. Then specific cortical areas, specific pain-related areas in the hypothalamus becoming activated, and from the brain there is a transduction back to the peripheral nervous system, accompanying with the release of beta endorphin and other neurotransmitters. So basically, in that stage, we feel the pain relief. Okay, so this is a basic acupuncture anesthesia role. Okay, in a very simple way. Obviously, it's more complicated than that. So let's go back to the laser experiment. Basically, in the laser experiment, in a non-invasive, non-traumatic way, laser light caused the mast cell to degranulate and to release histamine. So what does this mean? It means that this is basically can be an explanation of the basic mechanism of laser acupuncture. But more importantly, this study also suggests the important role of connective tissue in acupuncture. Okay, so this study, one of the reasons I really like laser acupuncture, because it helps us to understand the role of the connective tissue in acupuncture and the role of channels and collaterals in our medicine. Okay, so I find it quite interesting.